So Jenny is going to talk to us all about pelvic floor health for 20 minutes, drawing on her background, which is 30 years in the area. So she's a global expert in this area. And then we're going to have 10 minutes of questions. Um, okay, shall we kick off?
Sure, good. Thank you.
Cool.
Delighted to be
Um,
here.
Jenny, so you've been involved in women's health for 3 decades. Can you tell us a little bit more about how you got into this field?
My background is nursing and midwifery many, many years ago, but I've always been passionate about maternal health. And so that led to real curiosity in all aspects of maternal health, but in particular during childbirth and, of course, the muscles of the pelvic floor. I've got a PhD in bioengineering and I run a pelvic floor research group at the University of Auckland. Having spent, I guess, the past sort of 12 to 15 years now in the research field, I've really developed a deep understanding and appreciation of the role of the pelvic floor muscles in particular.
So, Jenny, can you give the uninitiated like me a little bit of an introduction to exactly what the pelvic floor muscles are and what they do?
Yeah, so they're a really special group of muscles, and I'm going to show you my trusty pelvis, not mine personally, but if you can imagine that this is your bony pelvis here, and the muscles of the pelvic floor sit at the base of the pelvis. So a group of muscles, it's not one muscle, it's a group of muscles that form the floor of the pelvis together with other soft tissue. And what they do, if I stand, perhaps can't see, but they support the organs of the pelvis. And so sitting right in the front here is your bladder. Behind
Mhm.
that in women is your uterus, and behind that is the bowel. And these muscles really support those organs of the pelvis, help maintain their position, but also allow things to relax when you need to go to the bathroom. But they keep predominantly, for the bladder at least, the urethra, that's the pipe that goes from the bladder to the outside, closed by being strong and functional. Um, for most women, when it's all working well, we're not very aware of it. And sadly, that means that our pelvic floor muscles receive very little attention. And so, as we go through life, in particular when we have babies, childbirth, but as we age, because we don't really see the muscles, we're not aware of them, we don't exercise them, we don't really look after them, and this can lead to symptoms where those organs are no longer supported as well as they could be, and you get symptoms, particularly leakage, or we know as incontinence, sometimes a bit of prolapse or bowel issues. And so it's really important. The pelvic floor muscle is a muscle like any other muscle in the body. And of course, it will respond to exercise as long as it's targeted. I guess the problem is it's difficult to know where those muscles are, mainly because we can't see them and we're not aware of them.
So how do I do a pelvic floor exercise? Can you guide me through it?
Yeah, so
Live on video.
so it's a really good question, and there's 40% of women we know are not able to contract their pelvic floor muscle correctly. So if I ask people on the chat now to squeeze and lift, would you be able to do it?
Trying.
Yeah. So it's tricky. It's tricky to know exactly what to do. It's often women are not given any other instruction other than that, squeeze
Mhm.
and lift. And those are the two actions that the muscles are able to do is to squeeze and lift. And so that supports the bladder neck or supports the uterus. But again, a very difficult concept to get to get right.
So so it's really difficult to get right. Is there a way that I can check if I'm doing it right? How will I know?
Yeah, so the best way to know is to get some sort of feedback. And that is by using a intravaginal device because as I explained, the muscles sit at the bottom of the pelvis. but part of that, the vagina goes through those muscles. And so those muscles actually interact with the vagina as well. So if you've got an intravaginal device, then you will be able to see whether you're contracting the correct muscles. Of course, the device has to be giving you good feedback.
Yeah.
Yeah,
So,
so
and
it
by
is that,
device, you mean like a pelvic floor trainer, like something I
like a
can put
pelvic.
inside? Okay.
Yeah, yeah, like a
Okay, thank
pelvic floor
you.
trainer. Yeah.
And, and what makes a good pelvic floor trainer? There's quite a few on the market. What should we be looking out for when we're working out to assess whether that trainer is the right one for us?
So again, one of the important things when you are thinking about your pelvic floor is to remember it's a muscle like any other muscle. So it has to move. Now, because it sits where it sits, it's got to move through its full range of motion, and that's quite tricky. Um, so the best thing to do is to use a device which is slim, flexible, and allows that muscle to move. So I'm going to show you now,
Okay.
because this is a good point to introduce femfit, which is the
Yeah,
device that we have created over the
yeah.
past sort of 10 years with exactly that in mind. So giving the user the ability to really see if they're engaging their pelvic floor muscles and allowing it to move. So I'm hoping that those on the call can see this device. It's very slim, it's very flexible, and it's got 8 sensors along its length. Now, these may not be visible to you, they're very small, but it allows us then, with an app on your phone, to actually see how those muscles are engaging. So, the
Okay.
deepest sensor, the one at the top here, will show what happens if you're squeezing your abdominals too much. So, if you're bearing down or if you're pushing instead of squeezing and lifting. So, when I asked you a few minutes ago to squeeze and lift, and you weren't really sure whether you were doing it correctly, the chances are many women actually squeeze their tummy together or squeeze their bottom together or squeeze their legs together. And that's quite tragic because we know that actually effective pelvic floor muscle exercise can resolve up to 80% of the symptoms of incontinence.
I mean, that's
So,
absolutely huge, isn't it? Without any operations or without any
yeah.
pads, just doing your
So
exercises
just
properly.
doing your exercise, but it's doing your exercises correctly,
Yeah.
and it's doing your exercises um, long enough with enough intensity to actually make that difference. So the muscles get a chance to adapt to that exercise.
So
So
how
yeah,
long do I need to do those exercises for? Because do I have to do them every day?
so we recommend that you do them sort of 5 times a week. So you
Okay.
don't do them every day. You need to, it's like a bit like going to the gym. You don't go to the gym every day. You need a couple of days off to rest those muscles so that you
Yeah.
get a chance to recover. Um, but the actual exercise program that's delivered by the app starts off at a lower intensity and then you build up. But in total, the exercises each day take between 8 minutes to eventually, in your final 4 weeks, to 16 minutes a day, which is not a
Okay.
lot to ask to get your life back.
It's not very long at all, is it? It's the time.
Really, not
It's
very long at all.
yeah, it's literally the time to go and make a cup of tea, really, or go and
Literally the time to go make a
yeah,
cup of tea. Yeah,
yeah.
yeah,
Okay,
yeah,
thank you. And then how long? So I need to do these exercises for between 8 and 16 minutes a day,
yeah.
5 times per week. How long do I need to do that for before I start seeing a difference?
So again, if you relate this back to the gym, you need
Hmm.
to go to the gym for a good 3 months before you start to see a real lasting change. Excuse me.
Yeah.
You may see a change after about 6 weeks,
Hmm.
6 to 8 weeks. You may start to notice that there's a reduction in your symptoms. Um,
Right.
if you stop at that point, the likelihood of it continuing to last is less than if you continued for the 3 months. So you need that final month to really build the muscle. Um,
Okay.
and we're not talking just strength here, we're talking strength and function. And they're
Yeah.
slightly different. So we want you to build strength, but we also want you to build a coordinated action between your brain and your pelvic floor. It was hard to find it, but
Yeah.
it's keeping that connection going. So it's learning different types of exercises, not just a squeeze and hold and lift. Doing
Yeah.
100 squeezes a day is not gonna. It's not the correct way to build lasting muscle function.
So it's like that mind to muscle connection that all the gym people are always
Exactly.
talking about.
Yeah,
Okay.
yeah. It's that
Just the
mind to muscle
muscle.
connection. Exactly.
Yeah.
And you need that muscle to move through its full range of motion, a bit like your biceps. So when you lift
Yeah.
a weight, you lift it all the way up like this. When you move your pelvic floor, you move it all the way. So you don't, sometimes you'll see other pelvic floor trainers which actually inhibit that movement. And
Mhm.
again, that's not allowing the muscle to improve completely with its function. So you don't want to squeeze against something. You want that muscle to move from the
Yeah.
back to the front. And that's the
So that's
lifting action. Yeah,
so that's the really bulky ones. They're not necessarily the best because they're not allowing that muscle to move. Okay.
exactly. So you're kind of squeezing against something. They used to have Kegel balls where you would just hold
Yeah.
it like an isometric hold. Now that can work, but again, you need to improve function and not just that holding strength. And so for some women, you'll find that they do that and yet they still having issues with leakage. So
Okay.
we know now from other uh, disciplines like exercise physiology that you really need to move that muscle, um,
Yeah.
not
Thank you.
just hold it. Yeah.
Thank you. And what position do I need to be in when I'm doing these exercises? Do I
So,
need to be moving
so
around like at the gym or sitting down
eventually,
or
but we always start as you do normally, in a easiest stance. So that is lying down. So for
Okay.
your first 4 weeks, you're lying down, and
Okay.
the types of exercises. So this is again, let me show you. So this is the device, and
Hmm.
you pop it inside, and it
Yeah.
sits in the vagina. You may think that it is flimsy or doesn't move, but it stays in position by design. So
Okay.
in fact, because we've worked with the engineers, it floats up a little bit. And
Okay.
then this little bit here is the communicator to the app on your phone. And
Okay.
oops, it's just a little button that you turn on. You can see the little light. Oops.
Yeah.
Yeah, yeah.
Yeah.
And then that connects to your phone and you're able to see exactly what you're doing.
Okay.
And then, as I say, it's progressive throughout the
Okay.
program. Yeah. So a
And
month
will
of
it fall
lying,
out?
a month of sitting, and a month of standing.
Okay, so a month lying, a month sitting, and a month standing. And I'm really sorry I got ahead of myself a little bit there
All
because
right.
it is so slim. Is there any danger of it falling out?
So again, it's designed so that it stays in place. And once you've mastered the exercises, you know what you're doing in the lying position. Moving to sitting, that muscle's already changing the shape a little bit. So when it sits inside, it will sit at a bit of an angle.
Yeah.
And so when you stand, and you need to stand, because let's face it, that's when the issues happen, is usually in standing, not when you're lying down. So leakage occurs when you're standing or moving around. So the beauty about femfit is that you're able to use it in the standing position.
Yeah.
Yeah.
Brilliant. Thank you. And obviously, I mean, this is a medical device and this is a medical issue, incontinence and prolapse and all these symptoms you've talked about.
Mhm.
Is this something, do I need to speak to my doctor or my physio before I start off with this device?
So you don't have to. Um,
Okay.
you can purchase it, and the good thing about FemFit by JUNOFEM is that you are given um, really robust support. So you're not left completely on your own. However, we do work a lot with pelvic floor physiotherapists, and we encourage you to see your pelvic floor physiotherapist if you'd like to, or if you're looking for one in your area, we can often put you in touch with a physio who knows about FemFit. Um, but it's not a requirement. It's not a requirement that you have to see a doctor or a physio before you can use FemFit. You are
Okay.
able to purchase it directly.
Okay, great. And
Yeah.
so it's obviously it's a medical device. Do I buy it in a chemist? Do I need a prescription for it? Just while we're on the topic of doctors and physios.
No, no. So you can go onto the website directly. So www.junofem.com, and you
Okay.
will see how to purchase. Um,
Okay.
and if you are working with your physiotherapist and they're aware of us, we often have a partnership with physiotherapists, and there's certain um, discounts. You can actually engage with your practitioner, and they can help you as well as us. So if
Yeah.
you give them permission, we can send them your data. So we
Okay.
really do work closely with healthcare practitioners, which is another point of difference to some of the other devices that you might find out on the market.
Yeah.
Um, yeah,
And and I know this from working with you, you do have a lot of partnerships with physiotherapists here in the UK, obviously as well as New
yeah, we
Zealand, where
do.
they're designed.
Yeah, we
Yeah.
do. Yeah, we do. Yeah,
Right. Right.
yeah.
Just aware of the time, quick time check. It's 10:22.
Mhm.
I haven't seen any questions in the chat. I'm going to have a little look. I have got a lot of questions from our socials, so let me see if anyone's added any new messages. Let me see. No, no questions in the chat. So I'm going to go straight to the questions from our socials, if that's okay. If
Yep,
anyone on the call has any questions, feel free to pop them in the chat, or like I said earlier, to email Jenny and her team at info@junofem.com. I just had to
yep,
check. I just had to check that email address. So that would be
yeah,
terrible
yeah,
if I couldn't
yeah.
get one email address. Okay, cool. So questions from our Facebook page. Um, is a femfit only for incontinence?
So no, so it's definitely a general pelvic floor trainer. So if you are struggling with symptoms of prolapse, and commonly that presents like a lump or dragging sensation in your vagina, often after you've been standing for some time,
Yeah,
um,
yeah.
this will help with engaging that muscle and strengthening that muscle and helping again with that support system. So definitely not. It has. We've also done a lot of work around pain, and you can see from the nature of the device that it is probably one of the few devices on the market that you can use if you've got pelvic pain. Or
Okay.
yeah,
Amazing.
so those
Thank
are
you.
yeah, but primarily incontinence, because incontinence, although it's very common, it's not normal. It's not normal, and there's something you can do about it. So
Yeah.
yeah.
So encouraging to hear that this is sort of an issue that
Absolutely. It
we can
is such
fix.
an issue. And I think we really need to change the conversations that you don't need to just use containment products or pads or, um, you can do something about it. And
Yeah.
again, I don't think too that many women realize that although we're all getting older, aging is inevitable, leakage is not.
Yeah.
Um, it's not
That's what
something that's to
beliefs.
be expected, anticipated, or put up with.
Yeah. And we've got a question in the chat from Meredith. Um, do we wear underpants whilst using the device? Does it hang out?
Oh, yeah, good question. So, when this is in position,
Hmm.
this little pod, we call it the pod, just sits
Hmm.
loosely in your underwear. So definitely you can put your undies back on, and then
Okay.
this just sits loosely in the underwear. Um, yeah, it's helpful if you wear quite not really very tight fitting, but not very loose underwear, so
Yeah.
that this is a little bit supported.
Just
So
tight
what
enough
you
just
would,
to keep everything in
yeah,
place.
just to keep it
Okay.
in place. Yep.
Thank you. And then there's a lot in the news at the moment, particularly in the UK, about my data being sold, and there's a lot about AI and, for example, the NHS data going to the tech companies and all the rest of it. If I'm so obviously FemFit is monitoring my health and my pelvic floor exercises. Is my data secure or does that go anywhere? Where does that data sit?
So it sits on our very secure servers. So
Okay.
every time you use it, it gets uploaded because we feed you back your progress. So
Mhm.
we do have to get that data in order to give you feedback. But we
Yeah.
are GDPR compliant. We've gone, as a medical device, we have to go through all the regulatory approvals to make sure the device is safe, which includes cybersecurity, which includes your data being protected. We don't ever have your data when it's uploaded is not uploaded with your name. It's got a very long ID, 14
Okay.
digits or so. So
Yeah.
it's completely anonymized in our service.
Yeah.
So it is safe and
And will it
secure.
go to my doctor? How does that work then? Does the physio or the doctor get a login to that system? But it
So
doesn't go
if
to
you,
medical records.
no, if you are wanting to share your data with your doctor or your physio, for instance, then you have to give us permission to do so. So
Okay.
it's your data. And once you sign an agreement with us, then we can potentially share it with your healthcare practitioner. But we don't do that without your permission. And it's a written consent within the app.
Great. Thank you so much. So it's completely secure. Thank you. That
Mm-hmm.
puts my mind at rest a little bit. Um,
Yeah.
yeah. We're really kind of running out of time. I think we can get a couple more questions in. I've got one here that is particularly pertinent to me, especially when I'm thinking of kind of other medical devices for women like breast pumps. Do I have to sterilize my femfit?
No, you don't have to sterilize it. What you do have to do is make sure that it's clean. So you
Yeah.
just wash it with mild soapy water before you use
Okay.
it, and then you wash it again when you finished using it. You make sure it's dry, and then it sits in its little charging case, which
Oh,
is
that's
looks like this,
nice.
and it just fits into your handbag. So once it's inside, it just clicks shut. There's a little port here for charging, as you would charge your phone, and then it's completely secure. You just need to make sure that it's dry when it goes inside, and just warm soapy water. No, you don't need to sterilize.
And I suppose on that point, it's really small, right? The case, it's a bit like the size of a
Yeah,
phone.
yeah. So
You could
it's
play with.
very similar. Whoops,
Oh yeah,
advertising.
advertising Apple products.
Yeah,
Um,
so
but that's
very
good to
similar.
know.
Good
So if
to
I'm
know. And
traveling or
you can take
yeah,
it. Yes, I was going to say you can
yeah,
take it with you when you travel. So
okay,
it's quite discreet. Nobody would know really what it is. Yeah.
okay, brilliant. Thank you. I've got lots of questions, but I've only got one more
Yeah.
minute. So let's see which I think is the most important question. But obviously, other people might have other questions. So like I said, feel free to email Jenny and her team and ask. Um, can I share my FemFit with a friend?
No.
Okay.
Straight answer.
No, it's a personal
It
device.
is your device. It's your
Okay.
personal device. It's a single user device. It's a bit like your toothbrush, you know.
Okay.
Most people don't share their toothbrushes.
No,
So
so not
don't share your
recommended.
FemFit. No. No,
Um,
definitely not.
okay,
Yeah.
great. So then I suppose the last thing is so to get hold of a FemFit, if I want to buy a FemFit, if I want to start testing the FemFit and training my pelvic floor, I go to junofem.com
Yes.
and
So go direct to our website, and there's a
yeah,
because we're having this International Women's Day, which we feel should be International Women's Month. We've got a
year.
discount.
Oh,
Oh yeah, certainly the month. Certainly the month. So the month of March, we've got a discount on for if you just through the checkout process enter the code, and there will be a 20% discount on the device for the month
brilliant.
of March.
So just to reiterate, that code is IWM20. So
Yes,
that's IWM20 for 20% discount on the FemFit device for the month of March.
exactly. Thank you,
Thank you.
Katie, for putting that correctly. Yes.
That's very, and thank you for the discount. That's very kind.
Yeah.
This, yeah,
Yeah.
and
Yeah. So
yeah,
we
I know
just
this is
want
an
women
amazing device.
to know more about it, to get exercising and to exercise correctly. So
Great.
yeah.
Thank you so much, Jenny. This has been
Thank you
fantastic.
very much. Thank you.
Thanks,
Thank you,
everyone, for
everybody.
tuning in.
Okay.
Bye.
Bye.